If you are someone that has dealt with chronic knee pain that's seemingly unsolvable for a very long time and or chronic lower back pain that's seemingly unsolvable for a very long time, I'm here to discuss something called left AFIR, which might just be the solution for you. So, left AFIR is a term coined by the Postural Restoration Institute that refers to the position that your left acetabulum should take on your left femur when you're in left stance properly during upright activities. That probably seems like a lot to take in, but give me 5 minutes of your time and I'm going to do my best to explain it to you. So, as functionally and physically asymmetrical human beings, we tend to get stuck in something called a left AIC pattern. And this is because we're stuck on our right leg all the time without even knowing it. And when we're stuck on our right leg, here's what happens to our pelvis. Bang. So, what happens on the right hemipelvis is that it extends, it internally rotates, and it adducts. This is right AFIR, or right acetabulum on femur internal rotation. On the left hemipelvis, we have the exact opposite. We have flexion, external rotation, and finally, abduction. There is a difference. Please know it. It's just that this is going in more, this is going out more. Okay, so also forgot to mention on the left, this is left AFER. Right AFIR, left AFER. This is what we're stuck in all the time, and I'm going to try and show it from the bottom. Hopefully you can see how that pelvis is rotating to the right when we're in that position all the time, right? Okay, so here's the thing. We want the opposite of that. We want to establish left AFIR and right AFER. We want to get onto our left leg properly, as I tried to emphasize earlier, because this is an issue of gait more often than not. And we have two things to take into account during gait. We have stance phase and we have swing phase. So what's happening on this pelvis is this. We are stuck in left swing, right stance all the time, and we can't switch back to left stance, right swing. In this position, so the right hemipelvis is in flexion, it's an abduction, and it's an external rotation. This is right AFER. And over here, this would be left AFIR. We're in left extension, adduction, adduction, and internal rotation. And this would be left stance. That is the goal of postural restoration for people that are dealing with chronic knee pain that seems unsolvable and or chronic lower back pain that seems unsolvable. It's about walking, and it's about the position that this femur is going to take upon this acetabulum. Or really, I should say, the position this acetabulum is going to take on this femur, because that's the overlooked aspect of how we need to treat lower back pain and, more often than not, knee pain. So, if you want to know what we need hamstrings, specifically proximal hamstrings, and we need adductors, specifically ischiocondylar adductors or adductor magnus. This is going to make it so that our pelvis gets pulled backward and in. And this is going to help us establish left AFIR on a biomechanical level and eventually a neurological level. If you are interested in seeing exercises that work those muscles and get us into left AFIR properly, I will leave in the link below a description, the description below, a link to videos where I discuss a knee pain outline and a lower back pain outline. And that is about it for me. If you have ideas, questions, or comments, please feel free to leave them below and I will do my best to get back to you. Also, if you like this content, please consider subscribing. I'm open to your ideas and suggestions. So feel free to be vocal about it. Thank you for your time, and I hope you have a good day.